And they're getting cell phone applications approved by the FDA, but again, they're not in charge of the hardware, and it's a real conundrum the FDA is having, because how can they go back and make Apple put in compliance stuff that's going to match 60601? So it's not easy. It's not easy whatsoever. But we went through with this, and just from a standpoint of investors are concerned, my investors feel better at the end of the day, because large enterprises are asking, if I'm going to partner with this company in the long term for healthcare, have they gone through FDA? Have they gone through FCC? Have they gone through the ISO, the CE mark with it? Are they going to be continual compliant in the future? They want to make sure that they're not investing in a company that the FDA can change a decision like that and turn you off in a heartbeat, that you've already gone through and done it, and you've already gotten your certification. It's a sense of having a little bit of insurance.
Great. Thank you, Ken. I think that's a pretty good introduction to some of the topics that hadn't been introduced earlier today. We've got about 13, 14 minutes left for questions from the audience. If we can start with some of those. Yes, front.
One key question that keeps coming up here. I work for a large engineering company, I'm a doctor, and from an engineering perspective, gathering physiological parameters is really exciting. Clinical relevance to some of this information, unless it actually changes a clinical decision, is there real value in 24-hour monitoring of someone's pulse oximetry?
It's absolutely, I mean, I think you're absolutely right. There's a big difference between some of the applications you're seeing out there that are health platforms, and there's a million of them out there that are just collecting data and just tracking data, and there's an alarm if it goes too high or too low, as opposed to people like WellDocs who are really creating, taking the data and actually analyzing it and doing something with it, and putting in real-time coaching and long-term coaching for disease management for diabetics. I mean, those are the kind of things that are really going to make the difference, not just the data. So you're absolutely right. The data is nothing. It's what you're going to actually do with it. But there are people out there doing something with the data. There are a lot of people out there just collecting data, and I agree with you, that's probably not necessarily the most useful thing. 100%, 100%.
Yeah, part of this is the same kind of hype that comes out of a show like CES, and that is folks get fascinated by the technology and forget what people are actually doing with it. So there's a lot of news about, look what you can measure, look about a new piece of data, and they're not really understanding what the business model is of the company that's bringing that piece of technology into the marketplace, which goes far more often than not, because it would be dumb not to, is to actually do much more than just kind of collect data. And I'll give you, here's a live example of continuous collected data that I'm sure you can find very relevant. This is a smart wireless Band-Aid for continuous glucose monitoring. So you peel and stick this, put it on. There's a little tiny microneedle involved here, and this was worn for 3 days for patients, and this then transmits. There's a radio in here as well as in this little package. And this is worn on the abdomen and transmits to another device that looks like a lot like a phone, and gives the readout to the diabetic patient. So, and is all part of obviously monitoring their glucose level, managing their diabetes. So this one has a pretty well understood continuous monitoring kind of use case and story around it.
I want to be very clear about where we're trying to go in this space. It's interesting, when I show up at Wireless Life Science, we're a member, and Don started Wireless Life Science. You see all these great companies that show up, like Corventis and Triage and Airstrip and Proteus, and and a lot of the devices that are out here. They're a great sensor company, but the bottom line is they need to get data from that sensor to a server someplace. And then on the server, you need a clinical support system that backs it up. And so that's truly in the marketplace what we're trying to be, is to try to look at the 500 million PCs in the world, the 4 billion cell phones in the world, but there's 50 billion type of devices out there, not types, but 50 billion devices out there that have wireless data coming out of them. It could be a loop recorder, a continuous glucose monitor, it could be an Airstrip, that need to get data from there to a central server and data back to it as well. And we want to be that platform to make the connectivity. I totally agree with you that I think that part of the inefficiencies in healthcare today is the lack of that connectivity. Right, the lack of data. We all know that people filling out a logbook doesn't work. It just mysteriously, the highs and the lows are eliminated, or they do it the day before, or whatever. It just doesn't work. You need to have accountability like this, and that's what we're trying to put in there.
Yeah, and it takes the applications from kind of the toy phase, which is the person and a lot of the apps you initially see where you can watch the charts and stuff, and moves it into really being a tool. But you have to have that data for the tool to be effective. And as you said, the logs don't work because you're giving the doctors or the decision makers incorrect information. And if by automating it simply we can ensure that the people have the correct information to make those decisions, then we are improving the whole system.
I was just going to say one thing else. You know what? We're really, really smart engineers, extremely smart engineers out there. But we consider our technology about 20% technology and about 80% psychology. That's what we say about it, because it's more about what they don't do with it, you know, than they do with it. I want it invisible in the background. I've found that people that, if they know that the daughter's waiting for those readings to come in, the mother-in-law is more likely to take those readings because somebody's expecting it. They don't want the pain of the carrot and pain of the stick, you know. I also want to look at is there's a $600 wireless Bluetooth scales out there because it will take care of something very sophisticated, or a $60 Homedic scale that's at Walgreens and you can do it with USB. I don't care if it's $600 or $60. I don't even care what the weight is originally that comes off it. I just want to know they took the reading, because if they took the reading, they're following the doctor's instructions, they're more likely to take their medicine and they're more likely to stay out of the hospital. It's the little psychological stuff that you can do to try to get them compliant.
Other questions? Yes, in the back.
Regulatory side, in the U.S., we've got 50 states with their own boards of pharmacy, boards of health, et cetera, et cetera. Just curious, are you running into issues with them, the board of pharmacy saying, we need to regulate the pill bottle?
So the question was about state-by-state regulation, particularly with some of the pharmacy boards.
We've run into some pretty significant issues on that. When we did our live nurse service, it turns out that you need to, if you're taking a call, so, you know, Jitterbug, we have a 24/7 live nurse, triage nurse. And basically, if you're taking a call from a customer in Texas, they have to be served by a registered nurse in Texas, if you can believe it. So these are the kind of complications we're running into, and you can imagine how complicated it is for a nurse service now to try to be matching nurses with calls that are coming in from across the country.
Yeah, very interesting question when you're dealing with professionals that are licensed by state. So interestingly enough, a number of the back-end systems are trying to abstract the professional out of the system to avoid that issue. So in other words, the states haven't figured out, another way to think of it, the states haven't figured out how to regulate a piece of software in the cloud and tie that to a particular state. So if the software is the one making the decision, because the physician has given a standing order, for example, that issue can sometimes be skirted. Now, that doesn't help if the patient needs to talk to somebody live, a nurse at a time. But certainly, I think in general, other than this issue where you're dealing with a licensed professional talking live to the individual physician, nurse, et cetera, for the most part, we're not seeing those problems. And in fact, pharmacies actually, at the retail level and at the mail order level and actually at the pharmaceutical manufacturer level, are very much interested in the technologies here because they want to be able to tie the consumer to the product and get them back for the refills, and so for both from the business perspective as well as from the compliance perspective. So anything that helps make the compliance goes up also obviously drives the business case for that particular drug or that particular retail pharmacy or mail order pharmacy.
We have time for just one more question. We've got about 2 minutes. The gentleman in the front row, please.
Are there any devices yet that are actually embedded in organs or have wires going to specific organs that send signals?
Absolutely. There are many, many, many wireless implants today. There are pacemaker models, defibrillator models, neurostimulator models that are all wireless. This I would call it quasi-embedded because there is a needle involved in this particular one, so it's partially invasive. Absolutely. You can get a pacemaker today that will wirelessly transmit the output from your heart and its various sensors today. There are ones that transmit to a nightstand-like receiver, so it picks up the data when you're sleeping. There are others that actually have mobile accessories that you actually look a little bit like a mobile phone. You carry that with you, and that actually transmits back to the back end. So that is actually a bit of a growing area.
So just to close the session with a quick soundbite, we've got about a minute to go. The title of this panel is Patients on the Go, Wireless Healthcare is Here to Disrupt. So will wireless healthcare disrupt the healthcare industry? David?
You know, I don't know if it's disrupt as much as just work with and help to improve. You know, this is about improving people's well-being by being better at doing some preventative